Welcome to the AUA News Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Hello, everyone, and welcome to today's episode. This podcast is brought to you by the APP Membership Subcommittee. I'm Leslie Lorbacher, and I've been an NP at UNC Urology in Chapel Hill, North Carolina for 10 years now. Today, we're diving into an important and dynamic topic in the world of healthcare, navigating the Urology Team, the APP physician dynamic. We'll be exploring the vital relationship between advanced practice providers, APPs, and physicians in the field of urology, how they collaborate, support one another, and ultimately work together to provide the best patient care possible. So whether you're an APP, a physician, or someone interested in healthcare teamwork, this episode is for you. Let's get started. Tell us, Heidi Colin and Dr. Pam Ellsworth, about yourself and the position and how long you've been working in your practice.
Hi, thank you, Miss Leslie. I
Welcome.
appreciate you. Your invitation, I think it was so much fun, this whole idea on how APPs and physicians do collaborate. I think it's super important. It's a very enriching topic, and it's a very vital topic for the future of healthcare, because that's just the reality of where things are going. I have been a physician assistant for 16 years, working on year 17. And I'm currently the APP manager for the Department of Surgery. And I work alongside Dr. Ellsworth since 2017.
Yeah, March. Giving us 17.
Yeah. So it's been, 8 years or so? It's been a wild ride, but it's been an amazing one for sure.
All right, we'll hand it over to Dr. Ellsworth to tell us about herself.
So my name is Pam Ellsworth. I'm a pediatric urologist here at Nemours. I came to Nemours in the fall of 16, joined this practice after being in academics, and this was, at that time, not really an academic institution, and I thought that I had sort of jumped off the cliff and was here to build a program. There were no residents, there were no students, and we had one APP, and it was sort of, okay, where are we going? And I had worked with APPs before, but my boss introduced me to Heidi and said, I think this is the person for you. And the evolution of our friendship and workplace and what we've developed and boundaries that we pushed working together has been a phenomenal 8 years. And I've been in practice for almost 30 years.
That's awesome. How many APPs do you have in your urology department?
So currently we have three
total, yeah.
All right, so I'm going to move to the next question. Tell us about your working relationship and dynamics with your supervising physician, Heidi.
Okay, so taking it back to 2017, I know it's been an interesting journey with Dr. Ellsworth. I remember in the beginning of my PA career, if you would have told me, oh, you're going to be working in pediatric urology and being there for 8 years at least, I would have told you absolutely not. That is not my future. That is not where I see myself. I'm doing orthopedic trauma all the way. And that's exactly how I started my career, doing orthopedics and neurosurgery, but definitely orthopedics. That was my heart and soul for a very, very, very long time. In the beginning of 2017, our boss, Dr. Gass, the big chief, I had called her back because I had left Nemours. I stayed part-time, and I said, hey, I need to come back. My family needs me to be closer. And she's like, well, I filled your position. I said, sure, just fire that person and hire me back. That's it. It's very simple. And she's like, I can't do that. I said, yeah, you can. You're the boss. She goes, I have a perfect person for you. And I said, I don't know. What are you talking about? She goes, you have to try her out. I want you to meet with her. Her name is Dr. Ellsworth, and she does pediatric law. I said, absolutely not. Nope. I'm not doing urology. I'm not doing circumcisions all day. Nope, 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 nope. And it's because when I was in general surgery here, that's a majority of the job that I was doing, a lot of neonatal circumcisions. But at the time, Dolores was very, very young here in Central Florida. And she tells me, Heidi, shut up. You'll be fine. Go meet with her. I said, okay, fine. And met with Dr. Ellsworth. It was after at the job that I was working at. I came after work, met with her, and I tell everyone the same exact answer. It was love at first sight. What made it so different, and I went in fearful because I'll admit, pediatric urology was not my thing at all. But I was open to the opportunity of growth and learning. And when I met with her, what made it so different is, well, what do you want to do? What do you want to do with the career? And I said, you're asking me. It's not what I want to do. It's what do you want me to do? I'm your PA. I'm potentially your PA. That's not a question that I ever gotten asked in my entire career. And she's like, I think you can pursue, academics if you want to. You can have your own niche in your clinic. We can do maybe stones. You can do maybe, since you've done circumcisions, you can develop that. Maybe we can have you do research. And my eyes went like, oh my goodness, I've met my match, because I've always been interested in all of those things. However, none of my previous attendings ever ventured to ask that question. What do you want to do with your career? How can I develop you? It's never been that type of conversation. So that was very, very different. And I think I was very honest. I said, well, at that time, since this, mind you, I graduated in 2009. And at that point, PAs were still, some of them had their bachelor's, some of them had their master's. It wasn't a 100% master's geared program. And I said, well, I definitely want to finish my master's since I'm going to be here. Let's just get, she goes, great. What do you want to do it on? I said, all these questions, I don't know. But I did know I wanted to do more academically. I wanted to do more with my career. And she saw that. And she tapped into it like big time. And like I said, it's been a love story ever since. And I remember the email that you sent me afterwards. It was the next day. She goes, oh, someone tells me you love crafting. I said, yeah, Christian. She goes, great, I need a point. We can do all this together. I said, wonderful. This is going to be great. Sure enough, like it's just, it was an amazing bond, but it all opened up by asking that simple question of, what do you want to do?
And I'll dovetail with that if I can take that lead. Kind of took the carpet out right out from my feet, in the sense that it's a partnership, and what does she want? And, to thine own self be true. People have said, students will tell you what they think you want to hear. But my goal is to, what are you passionate about? What are the goals that you see for yourself realistically, and how can we get there? And I'll be perfectly honest, I am type A, obsessive compulsive about things. T's have to be crossed, I's have to be dotted. I check things, trust but verify is my motto. And so, and I'm clear about that. And the expectation is that you will maybe not be as anal retentive, although Kaidi is, to taking care of things, take care of patients well. If you're interested in doing something, I will support you and help you, but I want you to take that lead in that initiative, and I will help find the way to get there. And, when I think about mentors, and over the years, I've had maybe one or two people that I can say have been true mentors in almost 30 years. And I thank them for their existence. And I realize that there's very few mentors out there for APPs. Students do far much better in terms of having mentors at their medical schools when they're doing rotations, but APPs get lost in the shuffle. And that's unfortunate because what I've learned is that we make career decisions for a variety of reasons. Some people have family commitments, other commitments that say, hey, well, they're honest with themselves. You know, I'd like a life outside of medicine. No, Dr. Ellsworth, I don't want to be on call every other night and, running in the hamster trail. So those things we work out, but then we figure out what are your niches. And Heidi had said to me, I'd really like to publish. Okay, let's think about what are you doing? What can we expand upon? Getting back to that circ, it was like, well, you do a great circ. Has anybody looked at outcomes of APP circs, right? Because we hear in the background, oh, they can't do that. And I'm all for pushing boundaries. What can we push? How can we get you to have the most autonomy we can without sacrificing any outcomes, but provide you with that ability to test yourself and to expand your knowledge, your presence. And so we started with circs. Then we said, you know what? Not a lot of people don't let APPs see patients independently, surgical patients. Well, let's look at that and see. Then we said, wow, you do a great circ in the office. Why can't you do it in the OR? We got Heidi doing circs in the OR. But we always said, let's make this somewhat an academic in terms of let's look at the outcomes. Let's show people what APPs and motivated APPs can do.
I think that's just such a great approach. Heidi, what makes your relationship with Dr. Ellsworth unique?
Oh, there is a lot that makes us unique. That's for sure. I think the vulnerability. I would definitely say being vulnerable, being authentic to myself and what it is that I want in my career, and knowing that I can always bounce things off of her. Even as I progressed, now that I'm an APP manager, there are times where I'm just, it moves away from the academic portion of things to, oh my gosh, I have this issue. I don't know what to do. And it might be an HR issue. It might be an interpersonal issue. It might be just something related to my managerial role that I dovetail on her. But I have to be able to have that trust. And that trust really stems from the beginning, because I will always remember this, like she said, she's very type A retentive, extremely. And I love that because I'm the same way. So if you see us together in a room, you see like, we just like bounce off of each other because we do align with how we take care of patients and how we look at medicine and just our responsibility and our roles, right? But it did take trust. And I remember in the beginning of our relationship, there was one time we were doing a laparoscopic orchidopexy together. And I don't know if you remember this or not. And she knew that I did general surgery and knew laparoscopy. And she was putting in the port, and I said, Dr. Ellsworth, your pressure's too low. No, that's the way it's supposed to be. Okay. Dr. Ellsworth, your pressure's too low. And the elasticity of the abdomen, she goes, I can't get this in. I said, it's because your pressures are too low. So she didn't concede. She's like, call someone from general surgery. Cool. All right. Like I said, this was like within the first month of us really working together. It's a brand new relationship. She didn't know me. I didn't know her. So the general surgeon on call comes in and she looks at the pressure. She goes, oh, Pam, your pressures are low. Heidi could have told you that. And I said, I did. So fine. Case was over. We did great. The next day she goes, okay, I concede. You were right. That takes a lot from a surgeon. And once again, I've never had a surgeon be as open and as vulnerable as she has been. To tell an APP, you are right. I was like, oh, can I have that in writing?
Can you put it in the pot?
And it's not to make her lower. Honestly, for me, it's a testament to the personality that makes this type of relationship work. It's a surgeon who is open to say, okay, this person, yeah, right, open to say, yeah, this person might know something more than I'm open to learn. Yeah, and you say yourself, I'm an old dog, but I can learn new tricks, right? Yeah, so she's always willing and open to learn, just like I'm always willing and open to share. So it takes trust, it takes vulnerability, it takes being authentic to myself and say, wait, I kind of think I know this a little bit. And obviously communication is important, but I think it's really being vulnerable and open to one another and hearing each other out, that really created that trust and really created that respect, that you and I really share.
I think the other thing for me was the willingness to support her progression, realizing just like children, they fly the nest. So if you get them too skilled, someone's going to scoff them. She's now a manager. I get her in the OR on Wednesdays with me. But, it was that willingness to say, I'm not going to be selfish and just pigeonhole you with this and keep you there and stifle you so you don't kind of spread your wings and fly and develop your own sort of agenda, if you will. I think I think it's one of those things that you say, I think someone always told me in a marriage that you never go to sleep mad. I think there is that openness. Today you were a little snarky, okay, yeah, I was.
Now she'll admit it. She'll say, I was a grumble bunny today.
I think we work together and sort of saying at the end of the day, and where are we going? And so, we're sitting here, and I joked about it's 8 o'clock and we're sitting here. But the reality is that's what we did. We would do our charts. We would bounce things off with our charts. And then we would talk about, okay, abstract deadlines, this. What about this? Have we want to try this? In the OR, I really took, having been involved with residency and, teaching residents and progression of skills, I took that same residency concept to mentoring as a PA. Hey, Katie, want to do this? Let's do this. Okay, I'm doing the back wall of the pyeloplasty. You can do the front wall. I mean, it was not, but she's motivated. And when I watched, if we were doing a case, instead of standing there, she would, put the retractors in. She would know where to go. She watched, memorized, redid, and sort of looked at things as opposed to standing there like, I got some retractors. Okay, are you done yet? And so that was rewarded in the sense that you took the initiative to remember is let's do a little bit more. Let's do a little bit more. And I'm not sure everybody's willing, and I trust her skill set to say, let's push it a little bit, just like I would maybe a resident, not all the, but, and I think that was the wonderful thing, was just having someone that had intellectual curiosity, wanted to take care of patients' wells, wanted to develop surgical skills, and was willing to do the extra effort to, as I said, push those boundaries, see where she could go.
And at the beginning, it was a lot of, you need to read on this. Oh, hey, Dr. Ellsworth, I have this patient. This is what I'm thinking. What do you think? So before those abstract deadlines and all these outline stuff, it was really hey, I have this patient. I think this is what I need to do. I read on this. What do you think? So it was those conversations that also occur. I mean, yeah, I do remember being here late, closing charts, or, especially if I was on call and she was on call, it's like, hey, my kid is okay, because I am a mom, so I do have a kid at home, and I know that's probably some people think like, how can you do this and have a family? Yeah, it's all about communication and being honest and being vulnerable. Same thing, and there were moments where her and I will burn the midnight oil and just
well, here we're writing the abstract epic island with a glass of wine and a takeout meal. Don't and I think that was it. It was just a recognition of goals, both understanding where we were both coming from and trying to support each other in thriving. And to me, leadership is mentoring. Leadership is that vulnerability and honesty with each other, but always saying, at the end of the day, you have to separate my selfish needs for what's best for that person.
And little does she know, a lot of her guidance towards me is what I use with a lot of the APPs that I manage. when we have our check-ins, we just went through performance management, as everybody probably went, year-end, things. And I noticed a couple of the APPs are interested, or I see that they're good at this. And I said, hey, next year I would really like for you to do, probably present at XYZ. Really, you think I could do that? Is this something you want to do? I think we can. We can help each other. And sure enough, I have one APP that just told me, hey, I think you sent out this email. I think I want to present here. I'm like, great, let's get it done. And it's a lot of the same interactions and how she dealt with me that now I'm passing on to the other APPs that I manage.
And I think our relationship and what Kaidi's done has stimulated the Department of Surgery to not just think about APPs as the tool. You're at my side, you're my scribe, you do this, but rather as a integral component to the Department of Surgery that has skill sets that can be developed to enhance their satisfaction with the job, right? If you come in, hey, someone says you're doing this, and you may not want to do this. Okay, Kaidi, what do you want to do? What aspect are you interested in? I could say, you're going to do this because I like doing this, and I'm going to give this to you, and you're not interested, but tough to-dos. And what happens? You get bored, you get frustrated, you're either going to be burned out or you're going to go, okay, 8 to 5. Oh, it's 4:50. I'm ready to walk out the door. And I think, if you're passionate about something, if you love it, if it keeps you, motivated, you feel like you're learning, using your brain, and you're being respected for what you're doing, you're going to do a better job. You're going to be happier and satisfied.
So true. I totally agree. Kaidi, coming from general surgery, what challenges have you had with previous practices?
So that's a good question. I think my biggest challenge, it wasn't the academic stuff, because it's very, right, you can give someone an outline. This is what you need to do. This is the book that you need to read. It's really being respected as a colleague. And I think that's what made my relationship with Dr. Ellsworth very different. And it's also, it's not about the skill set, because the skill set was there. You learn and you progress throughout the years of whatever subspecialty you're in, right? So it really wasn't that. It was really having someone to think of me as a colleague, but also think of me as a person, and seeing how to develop that from there. Kind of like what she just said, it's not the 9 to 5, this is your role, this is what you have to do. And then if you don't do it well, you are chastised. If you don't, if you miss this, you don't learn from it, you get belittled for it. So it's being seen as more of a minion kind of a thing. This is your role, this is what you're supposed to do, versus we are colleagues, let me help you grow. And how can we make a model of what we have to everyone else? And I think that's what Dr. Ellsworth kind of alluded to, where when you see her and I work together, it's truly a partnership. Where
That's exactly what I was about to say. It's you guys are just like two peas in a pod, It's a total partnership.
But it's from the very beginning. So that's the hard conversation of sitting down and saying, okay, let's be truthful. What do you want? Kaidi was the first PA to get into the leadership program. It was like she wanted to be, advanced. I said, look, where do you see it? You want to be a dean? What do you want to do? We need to work. No, but we need to check off the boxes. We need to sort of put you on a plan, much like you would do with the junior faculty. Okay, you want to go up the academic range? You want to do this? This is what we got to do. So let's get these little pieces together and work on what's going to happen as the years go on. And I think in a short period of time, she's a manager of it.
Yeah. Is there anything that you would change about your current practice?
I think we have this intense distaste with the fact that Kaidi was doing circumcisions independently in the OR. We had cleared that with our chief. I was in the OR in another room. We knew that we had, if she had a problem, she could get me. She was already doing minor procedures, but I really felt very comfortable and said, she can do this. I'm taking full ownership of this. And we got that started. But unfortunately, our colleagues in anesthesia did not have the same sentiments with respect to the CRNAs. And so they felt that our pushing this little envelope was going to be threatening to them in terms of how their relationship was. So if I could speed back, go back in time and change how that was affected, I think that would have been something that would be very productive. And it bothers me that, others are not as enlightened, if you will, or willing to say, I put my faith and trust in this person. They've demonstrated to me they can do this, and I'm going to allow them to do that and take ownership of that.
Anything for you, Heidi, that you would change or just the same?
I think, definitely the sentiments, obviously, of APPs in general. With the whole idea of scope creeping, it makes it very challenging for PAs to push that envelope. Dr. Ellsworth and I definitely work very hard in doing that here at Nemours. And I think, definitely having the ability to be able to do more independently would be amazing. What else?
I think when we first got here, the APPs didn't have really a voice at the table. That's a presence at the table and a voice. And it's evolving. I think as we have Department of Surgery meetings. And so when we're making presentations of what people do for the academic, they're hearing what Heidi's been doing. There's a like, So I think there's been a lot of progress, but it's taken time. And I still think there's a fair number of individuals out there that maybe are comfortable with themselves to say, this person's great. And whatever title this person has doesn't matter.
Yeah.
It's how this person is functioning that is phenomenal. And I'm going to support that and recognize that.
Yeah, I think that is the biggest thing, is being able to be seen more as a colleague versus as MD and PA or APRN.
Ladder. Yeah.
But
meeting together at the table, right?
Absolutely. And as Dr. Ellsworth said, the hospital in general has made humongous strides. I am one of 7 APP managers at the hospital. And so it's the Department of Surgery, NICU, PICU, outpatient, cardiology, CRNAs, and emergency medicine and orthopedics. So I'm one of 8, actually. And we sit down and we've created the APP Council, the APP Leadership Council. And since I think we started in January 2023, since we started that, the strides that we have done with that Nemours to make the APP's voice that much louder has been monumental, honestly, for our career here at Nemours. We've implemented a new to practice series for the APPs that just start within Nemours and who have started and are under 2 years of practicing. We have implemented a performance advancement model that actually financially incentivizes the APPs to work outside of their 9 to 5 or 8 to 5 timeframe, which honestly, when we started that, they go through different levels depending on their And I said,
physicians had it, but they didn't have any.
And I had told her, I said, this is not fair. I'm happy that we're doing this, but this is not fair because I've been doing this for gosh, how long, and I haven't gotten anything out of it. But it was those moves were very promising to the APPs, not only to continue to advance, get into research, get into mentoring, get into teaching, things that her and I have been doing for years, but also getting APPs invested in their career. Because once you see your job, once that changes and it becomes a career, it brings you joy to come to work. Yes, you might have bad days, but the perspective is so much different. It's an investment to yourself. As a mom, I say it all the time. Eventually, my son's going to leave me. And what is going to be my identity? I'm still going to be Heidi Cologne, PAC, period. And that's going to be part of me. So I am just developing myself. So now in turn, I can continue to develop others.
And I think that, when you're talking and like we're hiring people, not everybody's going to want to do that. And so again, the idea is identifying and, putting it out there is if you're interested, and I will support if you're interested, but I will not mandate that somebody does something they're not wanting to really do because I feel they're not going to do as well. But for people that are interested, they need to find someone, a mentor, a physician that they feel comfortable talking to, that demonstrates mentorship, how they treat others, so that they can say, hey, I'm interested in going further. Can you help me get there? And I think that's the, kind of courageous conversation, because you don't want the door closed in your face, but that's where you sort of look at how they're doing. So I don't know if you're a place, but we have provider meetings. So it's not just the physicians meeting to go over things. It's the APPs and physicians to go over things. We have journal club that we're all present at. We have one other APP, Catherine. And when Heidi was in New York, when she abandoned us for a little bit, Catherine had expressed an interest, and I said, okay, let's open up this computer. We're putting together an abstract, and boom, boom, boom. And I think she was like, whoa. I didn't have a chance to sort of say but or anything. And she got her thing accepted, and she has expressed interest in doing more with the AUA. We have another one that was doing our spina bifida clinic. And I said, this is like a big thing. Why don't we get you out to the spina bifida meeting and give you some contacts and some people. And, these two were courtesy of my research monies and some leftover that I said, look, I got to get somebody moving out. And so we looked for monies. We petitioned for monies to help support things. We were bunkmates if need be, look, we'll cut the bills. You can stay with me for nothing, and it doesn't come out of your expense account, no, but that, again, that's what it's all about. How can you get exposure if the reality is your stipend is less than ours, right? So you're going to cover your registration, your airfare, and you're going to go, I'm going to stay and I'm going to starve. Okay, good. You can stay, that's fine. So I think it's just the little things to sort of really support that I don't think take too much. And, you would do it for a friend. And I consider my colleagues, most of them, friends. And I consider, us on par, in terms of things.
What advice would you give to new graduate APPs regarding working with their collaborating physician?
I know this is easier said than done, but release the fear. They are humans just like you are. Obviously, mutual respect is important, but it's you are not less than. You are enough. You are good enough to say, hey, this is what I want to do. These are my goals. Be very open from the beginning on how do you envision using an APP? What are your goals for your APP? Have you previously used APPs in your practice? And if so, how do you work with training them, right? Most of the time in the beginning of our career, all we do is like, yes, sure. And then when we get there, it's, oh my gosh, this is not what I expected, right? So but it's very important, going back to being vulnerable, being authentic, to own thyself be true. You have to know what is it that you want within your career to be able to have these courageous conversations with a potential employer.
And we're we are victims sort of, or we are a result of how we've been trained, right? So if we work in an academic where there's residents and medical students, we have those guys with us in the OR, perhaps all the time, and whatnot. And so we may not have the opportunity to really talk with an APP, find out what they're interested in, develop skill sets, see if they like something. I have to say, before coming here, I really didn't have APPs in the OR with me very often because we had medical students and residents, so and then coming here without that really opened my eyes to say, hey, okay, I have a person working with me, but I treated that person as, and again, that same educational development approach that I would with a resident. And, if you're doing the job and you're going, we're going to push it, we're going to do more. And so I think, again, to thine own self-truth, as an APP, you have to decide, what do you want? Do you want to become a leader? Do you want to be more in academics? Do you really just want a job at the end of the day you can go home, close the book? And I'm not saying that's bad.
That's fine.
But in
Funny,
order
that's
to
some people. Yeah.
And that's okay. That is
But if you say, I really want to take this and I want to develop myself as best as I can, maybe I want to be a dean, I want to be teaching or whatnot. Then you say to that person, I know maybe even I'm a new PA and I'm new to this, but I would like to explore all that this career has in terms of options. And would you be able to help me looking at maybe developing my opportunity, maybe doing this? And if the person says, I don't know, no, then you say, do you know someone that could? And it might not always be the person you're working with. It could be somebody else in the institution that can help with that. It's like the medical students that rotate and you say, you don't have to tell me you love your biology. I'm okay with that. We're going to get you here in urology, but what do you want to do? I have students that do fire projects, their research projects. They don't want to go in urology. One wants to go in rehab medicine. Great. Let's look at cerebral palsy and retention and what happens in those kids. Another one ended up looking at radiology. Let's look at something radiologic based so you can do that. So that's the other thing is, if you want to go into leadership and then you say, well, I think we need to look at so-and-so because she teaches the leadership course. Or how about this person? This person came from a nursing background. She's moved up the ranks. Why don't we talk to her? So it's helping you navigate that abyss of who, if your colleague, your physician, provider can't help you, who can help with that?
Right. Just helping the new graduate kind of learn what their niche is going to be, right? All right. And how can APPs be kind of effective leaders in their practice?
Ooh, there's so much there. Being effective leader, once again, it goes back to you developing yourself. What do you want to do and growing from there? It is okay if you want to be the 9-to-5 APP or the shift worker. Trust me, there was a point in my career that I had to do that, and it was great. I had 3 to 4 days off a week, clocked in, clocked out. I was happy. But there's seasons to your career and there's seasons to your life, right? So it's understanding what you're good at, understanding how you want to grow within your career, understanding that leadership is not for everyone, and that is okay. Because a lot of the APPs that I work with flat out say, I don't know how you do your job, but it couldn't be me. And I said, it's okay. Margaritas every night works well. But it's really, really knowing what you're passionate about. And it doesn't have to be leadership in administration. It could be leadership in taking on an APP student. It could be even when we had medical students, some medical students
Work with them.
don't understand how to
The role of APP.
the roles of an APP. A lot of them thought that all I did was scribe for her. And when I would approach the OR and say, you got to move over to the side, they were like, oh, okay. I'm like, yeah, this is a partnership, and understand that The better you train your APP, the more you invest in them, it will make your life so much easier.
Or when they're realizing that the APP is going to teach them. Yeah. We always love that. Now, Kylie's going to
Now I'm gonna, yeah. So it's one of those things where it doesn't have to be humongous and big. And I mean, you can even start small within your practice and say, okay, how can I help the MAs be a little more efficient on X, Y, and Z? So it's not leadership as just administration, is where you're at and how can you make your career better.
Leadership is a very broad term. When I think about all of the aspects of medical school, you can take an active engagement and help developing changes and plans of care for patients, whether it's developing pathways in the emergency room, the floors that you see. You get phone calls. You see inefficiencies. You see areas that could be open for errors or things that bog the system down. Saying, hey, I noticed that our discharges are delayed by 3 hours because of this. Why don't we work on a clinical pathway that's going to change that? We've done that. There is quality. I think we could fix this. How about if I take on the quality initiative or help with that? There's the academic part. There's the organizational part. Yeah, our meetings tend to be a little scattered and we don't have an agenda. How about if so there's a variety of ways within the system. Financial. How can we optimize, financial things? Are we billing appropriately for this? Are we adding in blocks the way you should be? So there's different avenues depending, again, on what your interest is. And so I think it's thinking about, but sometimes someone has to say, okay, here's all these opportunities. These are what these involve. And then get you in touch with someone that can help with the next step.
Such great insight. Well, I want to thank you guys so much for spending time with us today. I feel like your relationship's a true partnership and very unique. And I really appreciate you guys sharing.
With our pleasure.
This is fun.
It's a chance to have an excuse to be.
You guys nailed it for sure.
Thank you, Leslie.
Of course, you made my job so easy.
This has been an AUA News Inside Tract podcast. To hear more episodes of this podcast, visit www.auanet.org/podcast.